Well, good morning, good afternoon, good evening, everybody, wherever you are. Welcome to the Vegan World 2026 Moonshot podcast. Today, we are going to be talking with Anthony Masiello of Plant Based Telehealth. This is an amazing new service that's being offered to the community. And welcome, Anthony. How are you?
Thank you. Very great. Thank you. Yeah.
So let's begin by asking you, uh, when did you get this idea and how long have you been working on this?
Yeah. So first, I just want to say thanks again for having me. And most importantly, thanks for getting it. You know, when you sent the email and you said you want to help us to make sure that people know that we exist, that's absolutely our mission, is to let everyone know that they have an opportunity to have their medical care aligned with their either vegan values or their whole food, plant-based, healthy lifestyle, or their or their vegan values. So thank you for getting that.
Yeah.
The idea for plant-based telehealth, it came to me in about January 2019. I guess, can I give a little bit of my background story?
Sure, please.
Okay. So myself personally, I grew up obese. And by the time my wife and I were having children, I was denied a 20-year term life insurance policy. This is in 2005. And it was scary to me. So I knew I had to do something about it. I was obese, I was sick, I was on medications for high blood pressure at a young age, all of those things. So I personally found a whole food plant-based diet by reading Dr. Furman's book, Eat to Live. And I completely changed my life. And since then, I've been really excited and sharing my personal story to help other people to know that this is possible, that we can kind of take charge of our health. And the problem for me was I didn't really know how to do that. The best I could do at the time was really just to share my own personal story and my own personal journey, and to get opened up on that, and to really kind of let people get to know me and understand that they too could do this, that there was nothing special about me, that this is just something that worked. That really wasn't good enough for me, just doing it that way. Like, I really wanted to do more, but professionally, I was trying to figure out how to shift my professional, I guess, career in line with my personal values. And so I had just been exploring. I started doing a little bit of health coaching, which I love doing because I get to help people individually, one-on-one in that way. And that's really nice. But I was thinking, how am I going to help thousands or tens of thousands of people? And then I would go to conferences all the time. And sometimes I would get to share my story on the stage, or I would always get to see a doctor, a physician presenting. And a physician is presenting and shows all these case studies, so how they helped patients to basically improve their quality of life, really. Right. Whether it was by getting off some medication or by controlling some disease state that was out of control. And then, every single time someone in the audience would raise their hand. And they would say, I'm really inspired. I'm sick with whatever their personal problems were. And where can I find a doctor who can help me to change the way that you've helped your patients?
Right.
And there was never an answer, because it's complicated. Our medical system is complicated with state licensure. Where people live matters. Geographically, it's very hard to get access to these doctors. I mean, we can, if you're willing to, so then the questions have to start. Well, how much can you afford to pay? Can you see one of these kind of like founding father celebrity kind of doctors? Can you afford to do that? Can you go to a center and can you stay there for a couple of weeks? Right. Or can you go to Cleveland and make an appointment, with Dr. Esselstyn if you have heart disease, or who's near you, or, all of these things. And I thought that's too complicated. Like, the medical movement needs to kind of get in line with what all of us are doing, with our vegan values, and also with our quest for optimal health.
Right.
Well beyond what's good enough, by the medical community. So my background is computer science. And so I knew that, but I've worked in healthcare my entire career. I started at the National Institutes of Health working on the Human Genome Project. And that's where I learned that there were people who were completely passionate about their work. And I started to fall in line with that as well. I later shifted into pharmaceuticals because I said, well, it's very interesting to figure out how diseases work, but I would like to help develop treatments for diseases, again, from my informatics perspective.
Right.
And now, since I learned how to recover my own health and live a higher quality of life, I was saying, wait, wouldn't it be better to help people to prevent disease altogether, or to better control or better manage their disease with healthy lifestyle versus the medical medicine and therapeutics? So all of these things kind of lined up. And when I was looking around, I'm like, people don't know how to access these doctors. The doctors actually don't have the opportunity to build a robust practice because there aren't a lot of patients in a geographical area. But telemedicine is coming about, and it's becoming a real thing. And I just started adding up all these pieces, and then I had been doing some work on other projects with Dr. Lori Marvis, and she was doing some projects where she actually was licensed in 13 states. And I was thinking to myself, here's an incredible lifestyle medicine physician, who really understands the power of plant-based nutrition, who is not going to ask their vegan patient, where do you get your protein, or where do you get your calcium, and all of these questions, right? And she has a reach, not only just one state, but she can reach across 13 states. And if we built a platform so that patients knew where to find her, I bet you she would, a lot of people would be interested in that.
Right.
So that's kind of how it came into my mind. And then I just started planning, and the more I started writing it out, the more excited I got. Basically, pulling together a pool of physicians so that they can cover the entire country, so that everyone in the United States has access to a doctor who fully understands vegan lifestyle, whole food, plant-based nutrition, and will help them to focus on preventing and better managing, even sometimes reversing. We're very conservative with using that word, but sometimes it can be done. And also helping patients in a way that aligns with their personal ideals. And so at first, Dr. Marvis was a little bit hesitant because she probably knew a little bit more than I did about what's involved in doing this. So I'll just say we hit challenge after challenge after challenge after challenge as we were going. But I just also got more and more excited about the opportunity. So we just kept going forward, and we wanted to really get something out there before December. So at least that Dr. Marvis could have her first appointment before December of 2019, but we didn't make it. We actually ended up launching in March of 2020, right with COVID. And we have mixed feelings about that. I mean, I personally wish the COVID pandemic would never have hit. I don't think it was a great time to offer a service that was focused on wellness when people were shifting into big survival mode. But we knew going in my planning that we had two barriers. First, we had to convince people that lifestyle medicine is real medicine, right? Is a real legitimate way, evidence-based, that people can actually heal and prevent disease. The second hurdle we thought is we were going to have to help educate people so that they would understand that telemedicine is a valid platform for having a medical appointment. And the one thing COVID did for us is it erased that hurdle for everyone. Because now everyone has been doing telemedicine. And now I'm reading articles in the New York Times that say that patients actually prefer telemedicine. And, it was interesting. Some of the things that they prefer about it is that the doctor is always on time. How many times have we went to a doctor's office and someone's running later? My appointment is at noon, but I'm not even being seen until 12:40. and then I'm
Right.
being seen for a short period of time, and it was unpredictable. But now with the scheduling and everything happening like this, everyone has to stick to the schedules or the whole thing falls apart. So there are a lot of little benefits.
Right.
But the biggest benefit from my perspective is that now these patients and these doctors can access each other, from regardless of geography.
Right.
Now, medical licensing is still very important. So each doctor has to be licensed to practice in the state that the patient is in during the time of the appointment.
Mm-hmm.
And but we've got national accounts with both Quest and LabCorp. So if we need to order labs, most patients can find one very close to their home, and the orders just go out electronically. They get sent right back into Plant Based Telehealth. And also, same thing for prescriptions. If the doctors are de-prescribing medications, adjusting doses, or even prescribing new medications, we're plugged into the pharmacy system so that the scripts go right out to the pharmacy. And oftentimes, by the time the patient gets off the call and drives to the pharmacy, it's in the bag, ready to be picked up. So there was enough of that infrastructure, but I always say that we're kind of pioneering this together with patients, because it doesn't work perfect. I get calls from labs and say, how is the doctor in Colorado ordering labs for my patient in Massachusetts? I'm like, well, telemedicine, multi-state license in telemedicine. So.
Right.
Anyway, I've been rambling a little bit, but I hope that explains kind of where it came from and where we are.
Yeah, it does, definitely. And so tell us about some of the challenges you faced.
Yeah.
Yeah.
So the challenges are the technology. We evaluated 40 different telemedicine platforms. The good news is that we didn't have to build our own, because that would have taken years to do. So, but then when we got using them in practice, we find out that actually none of them are really as robust as we would like them to be. So I think they've all made a ton of progress in the past 12 months. We were evaluating all of these things long pre-COVID. So they're getting better, but the platforms are not, they're not, I guess they're not perfect.
Right.
But they're getting better. And
so what do the platforms contain? I mean, what is unique about this?
So everything has to be compliant. There's a huge focus on patient health information privacy.
I see.
And keeping everything secure. So we don't do any patient communications about medical information by email or anything like that. It all has to be done through a patient portal. So what we have, when I say the technology platform, we have an electronic health record system, which is called EHR. And that's where the doctors document everything. They do their charting and their notes. Then we have a practice management system, and that's where patients can register, enter their personal information, and then also pay for their appointments. So there's that kind of business layer. But it all also has to be just as secure and compliant as the electronic health record system. Then we have a patient portal. And the patient portal is where the patient, most people know what it is by now, but you can log in and you can schedule an appointment. You can look at your past appointments. You can read the notes from the doctor. If you have blood work or results that you have from other practices or something that you already have with you, you can upload that into the patient portal so that you can review them with the doctor. But that's where all the secure information exchange can happen between the doctor and the patient. We also have a messaging system. So if in between appointments, if the doctor says, hey, let me know if your blood pressure drops below, some certain number, patient can go in there, message the doctor right away. Doctor can write back and tell them what to do, or maybe say schedule a follow-up appointment, something like that. So that's what I mean by the technology. And that was our first hurdle. That's what slowed us down. Then there was, on the business side of things, it's very complicated to operate a medical practice. But we learned how to do that. That was in parallel, we hit with the technology challenges. Then there's medical licensing. That's a challenge. And the doctors each take care of that on their own, but it's complicated and it's a very, laborious process. And it's a lot of unknowns. Every single state is different. Some states, the physician can apply for the license and they can get the license in about a month. And other states, it takes over a year, and we don't know why. It's just because what's happening. So that's complicated for the doctors. And then also their malpractice, getting malpractice insurance that's set up that supports them doing telemedicine in multiple states is
Right.
It's just all new. And
Mm.
then I mentioned it a little bit, the labs, like it's new for them as well. We first set up our accounts with Quest and LabCorp, and Quest said, "Oh, you can't." So we first did this, Dr. Marvis and I. Well, we established these accounts and we got them working. And then she saw the first patient who lived in Pennsylvania, drove to a Quest in Maryland because it was just closer to home. They must have lived close to the border, and went in to have their lab processing done by a doctor who was practicing out of Colorado. And the lab could see that there was an order there. But they couldn't pull it up to see which tests needed to be processed. So I had to get on the phone and call them, and they said, "Oh, well, we're not in your Quest region. Apparently there are regions,
I see.
that these companies are set up." So then, it was a long process. We had to switch to a national account. We had to make sure all of our orders go out to all regions, because it was really frustrating that they could see it, but they couldn't read it. They could see that the record was there in their system. So, I guess those are just some of the challenge. And now the challenge is raising awareness. People to know that we're here. And I guess another huge challenge that honestly we've decided that we can't take on at this time is insurance and reimbursement. So we're not excited that we can't take insurance at this time. It's cash pay, but we're trying to keep it as accessible as possible. So the appointment is 30 minutes long, and it's $150, which we fully respect that many patients are paying for insurance already, and then we're asking them to pay out of pocket for the appointment. So we're doing everything we can to make those appointments as efficient as possible, so that it's still very productive for the patient. And then after the appointment, we can provide what's called a super bill. And the patient gets that. That's really just a fancy term for a receipt that includes the diagnosis codes and the treatment codes. And patients can submit that on their own to their insurance for potential reimbursement. But then it gets very complicated. It depends on the deductible. It depends on the out-of-network benefit. And it depends on how much that insurance company reimburses for that type of treatment for that type of disease.
Yeah. No, I realize that's really complicated, especially when you're looking at preventive medicine, like what you are promoting here.
Yeah.
Now, what happens to Medicare patients? Do they also go through the same thing?
Well, it gets even more complicated with Medicare patients, because a doctor is not allowed to charge a Medicare patient directly for services that would be covered by Medicare. So it means if a doctor is in the Medicare system, they have to just accept Medicare reimbursement for the services that they provide. But we can't afford to do that. So what we have is about half of the doctors at Plant Based Telehealth have opted out of the Medicare system. And once they've formally opted out of Medicare, that means that Medicare patients can see them and can pay them the $150. But unfortunately, it means that the Medicare patient cannot submit that super bill for reimbursement to Medicare. It's like the patient is basically agreeing to say, look, I know I'm going outside of the Medicare system, and I'm going out on my own, so I have to pay, and I can't, expect Medicare to reimburse me for that. Yeah. And it's tough because we have about 20% of our patients are of Medicare age. I mean, we don't track exactly if they are using Medicare or not, but we certainly want to be able to provide services to those people. Right.
Yeah. One question. I mean, do you now have doctors that are licensed in all 50 states?
Yes. Yeah. So we started with Dr. Marvis was licensed in 13 states in March of 2020. She started adding licenses, and then also we brought on Dr. Miller, Dr. Christina Miller, shortly after, and then we brought on Dr. Michael Klaper in June. And then between those three doctors, they got several licenses, and then they were able to cover all 50 states by the end of 2020. Okay. So then ramping into 2021, we've added more doctors. We added 5 additional doctors in 2021, and each one's with states, because now our goal is to make sure we have at least 2 doctors who are licensed in each state. And the reason why is because actually Dr. Marvis went ahead and got licensed in all 50 states.
Oh, wow.
Yeah. I mean,
is she the first ever?
She's not the first ever. They're out there, but she's one of the very, very few who are practicing lifestyle medicine and are available. So I say she's the most accessible lifestyle medicine physician on the planet, because she can also do international consultations, which basically means that anyone on the planet can have an appointment, at Plant Based Telehealth with Dr. Marvis. But what that means is that a lot of people are lined up to see her. So her next appointment, she's now booking. If you want an appointment with Dr. Marvis right now, the first available appointments are going to be like the second week of September.
Wow.
So she's booked out for 6. She's staying booked out for about 6 weeks. So that's not great for someone who has just gotten a diagnosis and wants to try to do something about it, maybe before going on medication, to see what they can do with some lifestyle changes. So we're down to 19 states where Dr. Marvis is the only available physician. So we're looking to get, to these. Some of the other doctors are expanding their practice so that they can see patients in more states. But then we feel like once we have 2 doctors available, then things will kind of balance out, and then we'll look to ramp up.
But that's actually good news that, that there are so many patients who want to come and see Dr. Marvis.
Right. Yeah, it's fantastic. And I mean, they keep coming back. So I know she's taking really good care of them. And that's the thing that we did, and I mean, obviously we can't all be here, but like I have these, these nice cards whenever I'm out talking about plant-based telehealth, where we can see Dr. Marvis, we can see Dr. Miller, Dr. Klaper. We have Dr. Jeffrey Pierce. He's out of Northern California. Dr. Kim Scheuer. She's out of Colorado. We have Dr. Nikki Davis. She's in Utah. Dr. Elizabeth Fontaine. She's practicing out of Vermont. And our newest, Dr. Colin Zhu. And he's practicing out of Southern California. So I take the cards with me whenever I go to talk about plant-based telehealth, because then I feel like it's, the whole team is there. They're really the ones, they're the ones who are providing all the care. I'm just kind of humbled that I have the opportunity to help patients have access to these kind of healers and these kind of doctors.
Yeah, we need people like you, Anthony, so we can make these connections happen, right?
Yeah. And we get amazing phone calls from people in the Dakotas or in in somewhere in Georgia, and they're like, oh my gosh, I've been reading about a plant-based diet, and I never thought I was going to be able to have a doctor who would understand, who would actually be able to help me. And that for me, that's what it's really about. I want to make sure we're not looking to kind of really drag anyone into this direction. But what we want to do is we want to make sure that anyone who's inching into this direction, that they can have the support, the harmonious support that they need to be very successful. And we know that speaks for itself. Yeah.
Would you, when you started your journey in 2005, would you have wanted a service like this?
Well, I was very lucky because when I started in 2005, I went to my doctor. And who had just recently, maybe 4 months earlier, had put me on blood pressure medication after I tried to delay for a long time. And I said, I bought this book. It's called Eat to Live by Dr. Joel Fuhrman. She goes, oh, I've heard of that. And I said, well, I'm going to do it. And she said, okay, then you need to make an appointment with me. You need to see me every 2 weeks. And so we just scheduled appointments every 2 weeks. And I did exactly what it said to do in that book. And she was, I want to say she was supportive. She was supportive of me. She wasn't supportive necessarily of the method, but she wanted to make sure that she knew that I wanted to do this, and she wanted to help to make sure I was doing this safely and responsibly. So she was monitoring me. She had me writing my blood pressure 3 times a day, morning, afternoon, and evening. And she had me taking it 3 times each time and writing it all down. And every 2 weeks, she would go over my logs and she would help me adjust the medications as needed and stuff like that. So I kind of feel like I almost had someone who was in my corner, who was doing that. I'll tell you, it was a huge part of my success, because if I would have went there and this doctor who, I had a relationship with for years would have told me, oh, that's not going to work. Or,
Right.
oh, you're not going to have enough protein. Or, oh, you're not going to have enough calcium. Where are you going to get your calcium? How can you give up, dairy, right?
Right.
If my doctor would have said any of those things to me, or if my doctor would have not been supportive, it would have deflated me. And
Right.
the part that I really care about is it would have deflated me in kind of a moment of hope, and also kind of a moment of vulnerability,
Right. Mm-hmm.
and I don't think that's helpful for anyone, and I don't think anyone does that intentionally. I want to be perfectly fair. I don't think that personally. I think physicians are such noble people who are dedicated to the service and support of others, and I know that.
Right.
Um, but all of these things, but what I want to do is basically stack the deck in favor of success,
Right.
and help them to get people who are going to be like, so when someone says, hey, I was diagnosed with prediabetes and I want to see if a plant-based diet would help me. I want a doctor that says, congratulations, good for you, and can help to say, yeah, it's going to help you, and it's going to help you in this way and that way, and it's going to help. And then when they experience that, and when they're healthy again, but then all the side effects that come with it. And the side effects are, they're also going to lose weight. They're also going to have more energy. They might sleep better at night. They might be more compassionate towards animals and also towards our planet, right? And all of these side effects are incredibly beneficial, right? And people just feel better, and they're happier, and they're more confident, and then they're more successful in other areas of life. But it's really hard to explain. It's really important to experience.
Yeah, so you touched upon something there, which is the education system and how it is sort of stacked against preventive medicine. It's not just in the medical education, but even before that, in high school and in school, we are teaching kids about, protein comes from meat and calcium comes from dairy and all this nonsense. And even, I was looking into the USDA requirements for school lunches.
Yeah.
It's impossible to meet those requirements unless you feed kids meat and dairy.
Yeah.
Okay? Because it's so out of whack. It's like, huge amounts of protein. It's a requirement for school lunches.
Yeah.
And, you ask them, is that based on science? It's not.
Right.
Or
it's based on third or fourth hand information that was once scientific at some point, but it went through that game of telephone where the message gets a little bit twisted at each step, and then by the time it lands on the kid's plate, that's where it is. Yeah.
Yeah. So we are basically, running our kids through an addiction system, right? So making them addicted to really bad foods, and then we have to play. How do you get them off that addiction when they're adults?
Yeah. And the answer to that is it's really, really hard. And I speak to that firsthand. I was first diagnosed as being obese in the 6th grade. And by the time my wife, by the time I was denied that insurance policy, I weighed over 360 pounds. Whoa. I was morbidly obese with a BMI of 46. And it was what I was eating, but it was also the things I was craving and where I positioned food in my life. The other thing, the thing you're talking about, like the addiction, it really hits home for me. But it starts usually in the, here it starts at age 1, I feel, or even before, when the kid is having a tantrum and we as a parent hand a lollipop. Right? Oh, you're upset? Here, have some sugar. Right? Or at the first birthday, we have this tradition, at least, in the circles that I am and the people who are the parents that I know.
Right.
When the child is 1 year old is the first time they eat cake. And usually it's a kid strapped in a high chair, right? Because they're not even big enough to sit in a seat yet at 1 year old, right? And you take the birthday cake and you put it on the tray of the high chair, and the kid starts to poke it and play with it, right? They don't know what this is. I mean, they know it's food, but it's birthday cake. They don't know it's special.
Right.
And then, either the parent or the kid will finally, the icing will touch the lips, right? Or it will touch the tongue. And you can almost see the change that happens in that child in that moment. And it's almost like, now I've had a taste of sugar and I'm going to be chasing this for the rest of my life.
Right.
And when I look at it in those terms, it's not such a celebration experience. And I will admit, I did that with both of my kids, so I'm not speaking that, from a perspective of other people should not do this. I did this. And you see, because then what they do is then they start smearing it all in their face, like they can't get it there fast enough, right?
Right.
And that's how we grow up,
Right.
It's a shame. Yeah, but it's normal and it's natural, and the best we can do is work with what we've got, and so change is possible. It's just hard. There's a lot of factors.
Yeah, I mean, you're pointing to a need for a systemic change.
Yes.
Where we don't do that on the first birthday. We recognize that sugar is addictive.
Yeah. Every time you win a game, let's go get donuts or let's go get ice cream. Every time, everything
Right.
is celebrated with food. And the problem is celebrated with these unhealthy food that blow away our flavor expectations that we can never maintain.
Right. Yeah. Yeah. But I'm glad you're doing what you're doing, because I think it's so important for people to have access and to know that there is a way to get easy access.
Yes.
To health like that. Yeah.
Well, thank you. And I said, I noticed it in your email that you sent right away. I'm like, he totally gets it. We just need to raise awareness, and if we raise awareness, I think that there are enough patients out there who really are looking for this, but they don't know that it exists. And we hear from doctors all the time, because actually, especially with the ACLM and other organizations, there are so many physicians now who want to practice this kind of care. There are physicians who don't want necessarily the patient who comes in and says, "Oh, just give me my pill." "Oh no, I'm not interested in changing," right? But to be able to play matchmaker a little bit and to help these doctors to find the patients that they're looking for, and helping these patients find the doctors that they're looking for, it's pretty exciting, because it really works. And we have a number of testimonials that have already come out in the short time that we've been around, where longtime diabetics. And then again, of course, they get their A1C under control, but then they start, like going for 12-mile walks on their day off, where they're basically just going and out and enjoying themselves and living a different quality of life than they ever expected. And they didn't set out to say, "Oh, I want to be able to, go for long walks." They just wanted to be healthy, or they want to survive, or they want to be well at first. But then all of these other things pile on.
Right.
It's really nice to see.
Well, are you envisioning a future in which there is a mix of plant-based telehealth and also in-person visits?
I would love that. I think we're just going to have to let the patient demand help to tell us when is the right time to make that happen. I know a lot of incredible lifestyle medicine doctors who have local practices, but it's as challenging as it is for us to access the patients, nationally. It just becomes more challenging when you've got a geographic area. I mean, clearly some are very successful with it and they're doing great, and other people are willing to travel, to see some of these doctors. But I would love to see a time where this is much more normal, and that's another thing that is on our business plan. It's on our list. Once we collect enough data, we want to start sharing this with insurance companies, with self-insured companies, and with the healthcare system, so that we can really show evidence of thousands of people who have been able to reduce their basically strain on the healthcare system by getting well, and rather than kind of maintaining this like state of disease management.
Right. But would that be good for insurance companies? Would they see that as good, or would they see that as a decrease in their business?
I don't know. I mean, they're going to have to adjust because right now it's not
Right.
sustainable one way or
Right.
another. So I think in the short term, I think they would see it as good because
Mhm.
basically, if they know that a typical diabetic patient costs an insurance company $14,000 a year, and if we get rid of that diabetes, patient is still paying for the insurance, but then the company's not paying out for the care and the medication that's required to manage the diabetic, right? So
Right.
I think we have a long way to go before before the medical system or the insurance companies start to worry about running out of
Patience.
customers or patients,
Right.
but wouldn't it be a fantastic problem to have? You
I
know,
know.
I think everyone would celebrate that. So I think it's years and years and years away before anyone actually feels threatened by the concept of disease prevention or reversal.
Right. Right.
Yeah.
So, what do you envision happening in the next few months?
Well,
Short term and long term. Yeah.
yeah. So short term, we grow like a wait, is it like an accordion? I guess. We expand one side where we get, we brought on a few doctors in the beginning, and then we
Mhm.
brought patient load up, and now we brought on some more doctors, so now we really need to bring patient load up. But then the option is going to come in once we have enough patients. Then we're going to really focus on how to make it even more accessible. And
Mhm.
one thing that we would like to be able to do in the future is some group appointments where maybe we can lower that $150 cost. We can even make that less expensive
Mhm.
for patients by having them participate in a group, like a cohort of patients who are dealing with kind of similar conditions. And
Mhm.
it's nice because that would create some community. Patients could learn from each other, and also reduce the expense for appointments. They could have more frequent appointments for less total money.
Right.
The other thing, and this is still probably at least 2 years away, is we do want to talk to insurance companies and figure out how we can do reimbursement. And even if
Mhm.
we find some progressive healthcare systems that are willing to start, some insurance companies that are a little more progressive, maybe we can do some pilots there and see how it works out. And again, collect some more data so that we can expand that more widely. And the other thing I would really love to do, I'm a collaborator at heart.
Mhm.
So I want to make sure that we're reaching out to other services that are complementary to what we're doing, like
Mhm.
our friends at Mastering Diabetes. It's
Right.
we just have a great synergy with them. So basically, they have the programs in place to help people reverse, well, better manage and or reverse their diabetes.
Mhm.
And but those patients require medical care as they go. So we're very happy and humble to play a small part in that, to have their clients
Right.
access physicians at Plant Based Telehealth. So again, they're
Right.
getting that harmonious care that's aligned with the education and the program that they're going through with Mastering Diabetes. So it really stacks the odds in the patient favor. And we have another collaboration like that with Plant Pure, where they
Right.
have a 10-day, they call it the Plant Pure RX, their
Mhm.
10-day immersion, and where patients go through, again, their 10-day basically trial, which
Right.
includes food and everything to
Mhm.
plant-based nutrition. But then the doctors at Plant-Based Telehealth are measuring, lab values before and after, and
Right.
showing the patient
Right.
what's happening inside their body while they're making these changes and stuff. So I would love to do a lot more of those
Mhm.
and kind of be that plug-in piece that that gives access to the medical care when it's required, when medical supervision is beneficial or required, to other programs that are out there.
Yeah. So when patients come who are just starting out on this path, I'm sure you have patients that are already plant based and they just want to maintain their health, right?
Yeah.
But patients who come who want to start out on this path, do they do they go through the same thing that you went through with your doctor, which is having their blood pressure measured every three times a day, and yeah,
So it's very individual. So each doctor
right.
is going to figure out what care that individual patient requires, and
Hmm.
how frequently they should be checking in with the doctor, or
Hmm.
how frequently they should be seeing the doctor. And
Right.
so that's independent. But the doctors will use our pool of resources to say, if it's a diabetic patient and they don't know how to change, then certainly we're going to tell them, hey, you should go sign up for the Mastering Diabetes program, because that's going to help you with how to shop, exactly what to eat on a daily basis, how to, develop your meal plan, how to get the coaching support that you need in between your medical appointments. Or for patients who are dealing with weight loss, sometimes we will send them over to Chef AJ or someone like that who has some education. So we're kind of using the tools that are available that are out there to support them. Now, and in many, many cases, that works really well. And then there are the exception cases. And from the plant-based community, we're seeing a lot of the kind of exception cases. I mean, we hear stories like I told my story in 2 minutes, right, in the beginning. My name's Anthony. I was sick and I was obese. I switched to a plant-based diet. Now I'm better, right? And the truth is that is kind of how it worked for me. But it was 2 years of focused, I almost want to say struggle, but not necessarily like struggle in a bad way, but it was focused learning and evolving and transforming that enabled me to do that. But we do see a lot of other people who are out there and they make all the right changes, but they still don't get their exact results. And in some of those cases, then one of the physicians at Plant Based Telehealth will be helping them to isolate. And there's two kind of things. If someone's cholesterol won't come down, right? They may really have genetically, high cholesterol. And then it's the doctor and patient's job to understand, is that a risk factor? Is that something that should be medicated? Can we do additional tweaks? Can we fine tune the diet? All appointments in our intake questionnaires, there's a 3-day food diary. So the doctor wants to know exactly what the patient ate for 3 days. And then in the intake form, it's also a typical daily meal. What does your daily intake look like? We're also asking about stress management. We're also asking about exercise routines. So the doctors will use all of this to help someone to fine tune. Sometimes as simple as going for a walk after a meal, 10 or 15 minute walk, might help to get to someone's blood sugars to where they need to be. In addition to, the healthy changes that they're making, things like that. So there are a lot of, I call them like the fine tuning cases that these doctors are seeing at Plant Based Telehealth, and they're able to help them to kind of get over that last step. I know Dr. Miller herself recovered from lupus, and she went through all kinds of food sensitivities that were just flaring up her autoimmune disease. And there was a time where she noticed that blueberries were flaring her up. Now, everyone on a plant-based diet should eat as many berries as they want, right? But blueberries were flaring her, so she went through an elimination protocol that she isolated that, she figured it out, and then she also went into like a reintroduction protocol where then she could start to slowly, now she can eat blueberries and it doesn't cause her a flare up. But it took time, to get to that. And these are the things that these doctors have learned from personal experience and also from their patients, that they're able to do that for those people who have, I guess, cases that fall outside of that normal stream.
Exactly. Yeah. Well, I mean, it's such an amazing resource, plant-based telehealth. I really congratulate you for having the idea and then actually going ahead and implementing it.
Thank you. Yeah. I appreciate it. If I would have known how hard it was, I'm not sure. but we're here now, and I tell my wife and family, or my kids who were born in 2005, now they're 15 and 17 years old, and the whole family has made some sacrifices to make this possible. But this is I feel like this is my life's work, and this is my contribution, and I'm really excited about the impact that it can potentially have.
That's so wonderful to hear. Now, do you also do pediatric care, or do you see families?
It's always on a case by case. I know that I think maybe the patient is 5 years old now, but But Dr. Marvis had a 4-year-old type 1 diabetic patient, last year, and I think now the patient is 5. But so I guess in general, it depends. Some things are hard to do, and these doctors are incredibly responsible and they're transparent. And as soon as somebody either writes in or calls in or even schedules an appointment with their reason, if they don't think it's something that's suitable for telemedicine, then they will advise them that they need to go see someone local. I mean, because obviously the doctors can't listen, they can't touch, to find soreness, they can't isolate, things like that. So it really is going to depend on the condition and what kind of care that the patient is getting elsewhere. So if someone's already working with a traditional, local doctor who's able to do all of those things that require to be in person, and they want the lifestyle coaching from plant-based telehealth, it could become like another specialist, like a complementary physician on the care team. But they might not always want to fully 100% take over. There are some things that they can fully take over, certainly diabetes, cholesterol, blood pressure, things like that, they can take over, no problem.
Right. So are there only certain types of patients that you see, or do you see all patients?
No, I mean, typically we get patients, like you said, patients who are whole food, plant-based or vegan and still have health complications, and they want to fine tune. They want to, tweak and improve. Then we see patients who are ill and who are interested or have just started on a plant-based vegan diet, and they need help transitioning and getting their outcome. And then we have patients who are healthy vegans, healthy plant-based, but they want to have conversations about optimizing their health, not necessarily just maintaining a good health. For example, if someone goes to a traditional doctor and their cholesterol is like 185, right? The doctor is going to say, going to go down the list and say, oh, you're in good shape, right? A doctor that is focused on optimal health and wellness might say, hey, your cholesterol is 185. Did you know if we get this down below 150, that there are very few ever cases of heart disease, with someone who maintains through lifestyle cholesterol that's less than 150. So it's a very different conversation than I went to the doctor says I'm fine. Really, that as soon as it goes over 200, then the doctor is going to say, oh, your cholesterol is high, you need a statin, right? So these doctors are going to try to catch these things. If they see cholesterol trending up, even if it's not into a range that would ever be medicated, they can still have that conversation and focus on wellness. And I just use cholesterol as that example, but they can really do that with all kinds of factors, and they can help patients to really optimize their health. And that's what they're doing with what I'm calling the healthy vegans, healthy people who are already on a plant-based diet. So they're not needing to focus on behavior change and things like that. They're just helping them to understand what kind of tweaks we can make.
Tweaks to make, yeah. Wonderful. Are you aware? I mean, Sarah is asking this question here. She's saying patients should be rewarded for being healthy. We need plant-based medical insurance coverage.
Yes.
Right.
I agree 100%. And exactly for the kind of appointment that I just described. Right. I mean, unfortunately, the medical insurance is going to just let those patients keep going, right, until they come back and their cholesterol is over 210 or over 220. Then they're gonna go onto the insurance system and they're gonna start getting their medicine. But isn't it great if the insurance companies reimburse earlier and help the patient to never need the medication and to never have all the other complications and side effects that come with letting their cholesterol go out of range? Because whatever it is that's contributing towards the cholesterol going high is also contributing towards the blood pressure going high, is also contributing towards the insulin resistance, starting to build up. So if we can, whichever one comes first, if we can help to optimize that one, we'll probably prevent all of them from ever happening. Right. So I agree. Sarah's a very forward thinker. Thank you, Sarah. Tell everyone.
Tell everyone. And you have a fan here.
Oh, well, we're mutual fans. Brittany's fantastic. Yeah.
Yeah. Amazing plant-based story. Yeah. And your story is amazing.
Yeah. Brittany has a fantastic story, and she does so much to really help people to bring this into the home. right? I mean, you can watch her cooking videos, and anybody can make, amazing meals, quickly and easily and delicious, and truly healthy. It gets easy when people are cooking, when they use their salt and their sugar and their oils, to make things taste delicious. But it's a real skill, and it's something that has to be learned to make things really taste so enjoyable without those unhealthy kind of additives.
Yeah, you're absolutely right. That's where you need the creativity of human beings.
Yes. Yeah.
So, yeah, well, thank you so much for your service to the community.
You're welcome.
I hope that this broadcast will spread the awareness. I invite you to come to our convergence and talk about this as well. So it'll get to a lot more people.
Yeah, I would love to do that. And I'm really looking forward to in-person events coming back so that we can get out there and really, kind of connect with people. I know it has to be done when it's safe, but I was very fortunate enough to go to the National Health Association conference about a month ago. And that's where I have these cards printed up, because I was standing there with all my, with all of my fabulous friends here who were practicing this stuff. And I was able to, have kind of different conversations. So I love sharing it. And we can bring some of the doctors as well. I know the scheduling didn't work out for today, but bring them and let them actually explain what they're doing with patients, and let them explain the results that patients are having. That was always helpful for me when I was transitioning, and I hope that would be helpful for others as well.
Yeah, we would love that. We would love that if the doctors would also come and talk to people at the convergence as to what they're doing and how they can help the community grow.
Yeah, they will definitely do that.
So the next convergence is actually October 23rd and 24th, Saturday and Sunday.
Okay. And that's that's a virtual event as well?
It's virtual. We are trying. We want to make it an in-person in October. We'll see what happens with the Delta variant.
Okay. Well, my fingers are crossed for you. I hope it gets to be in person. But either way, let's talk about it. I would love to participate and have some of the physicians, whoever's available. I'm sure they'd love to come and share. We're all so passionate about this. I'm lucky to be the one here talking with you today, but it could have been any of us sharing the same information.
Yeah, thank you so much for making the time to come here and talk to us. Is PCRM doing something similar? Are they trying to do something similar? Can you collaborate with them?
We've spoken with them a little bit. I mean, I've been a fan and admirer of Dr. Neil Bernard and the PCRM for a long, long time. They have an inpatient. They have an in-person healthcare. I forget exactly what they call it, but they have physician services there in person in the Washington D.C. area, and they also do telemedicine. And I think it's about I forget how many states they have. It might be 13 states, and they have physicians who are doing that there. So it's complementary in the sense that we can help patients in the other states, and I guess there is also some overlap in what we're doing. I don't know. I just don't know exactly their approach to how they're seeing patients and how they're helping. I don't know if they're also able to help take insurance or not. I'm not sure about those details.
Yeah, a collaboration would be awesome. Because they're actually involved in a lot of things, right? PCRM.
They do a lot of fantastic things. I've been a member of the PCRM for a long time. And I enjoy getting the mails and the updates and the emails and the letters. It's a fantastic organization, and they're teaching physicians as well. They're teaching physicians. They're teaching also coaches how to do their Food for Life cooking programs and stuff like that. They're doing a lot of incredible things.
Absolutely.
Yeah.
Well, thank you, Anthony.
You're welcome. Thank you.
It's a pleasure to meet you and to speak with you. And we will be in touch.
Thanks. You too. Okay. I'm looking forward to it. And thanks again for seeing the vision and for helping us to share the message.
It's my duty. Thank you.
Okay. All the best.